Okay. Good morning, Cleveland. This is Jocelyn Dornbier,
Keelan Spillman,
and Michaela Currents with Ursuline 10 News.
and today we're reporting on recent events in the NFL showing racial inequalities in our country are still present despite claims that those times are long over.
You may just be as shocked as we are. Kaylin, Philip.
former NFL player so-and-so is filing a lawsuit against the National Football League for refusing to compensate for the player's on-field brain injuries, despite the league having a history of compensating for other retirees' injuries and medical costs. Why has so-and-so been excluded? They blame the settlement program, which according to BBC News applies a binary standard known as race norming that assumes that the average black player has a lower level of cognitive functioning than the average white player and adjusts their cognitive scores accordingly. Following this race-based formula, the NFL requires that black players must demonstrate greater levels of cognitive decline in order to be eligible for any sort of payout. Using this, black players are less likely to receive compensation and medical coverage for their long-term effects from football, such as their brain injuries and cognitive disorders like dementia, because of a system that was created over 40 years ago to install racial bias into aptitude tests.
Yes.
It's difficult to hear that our country is still following such a biased system after all these years. This really makes me think about the term we learned this semester, othering. For those of you who weren't absolutely blessed to take Loeffler's class this semester, or just never came to class, othering is when one group, Americans, excludes or marginalizes another group, African Americans. In this case, America has developed a system that has given the belief that all black Americans have lower intelligence levels than white Americans. This is a power move to put white people in a more intelligent and dominant position, putting African Americans below them on the racial hierarchy.
What a shame, especially with the NFL having so much impact on Americans. This reminds me of Americana, when Blaine's high school white teacher told him to focus on getting a basketball scholarship. Black people are physically inclined and white people are intellectually inclined.
Yes, good point. That book has so many good examples for this topic. For those of you that don't know about Americana, it's a story told by a woman that grew up in a lower income country in Africa and comes to America for college. She learns the ways of America, including the racial biases and discrimination held towards African Americans.
Over time, she quickly learns that being black in America means something much different than it does in Africa. She learns about the racism and discrimination that comes with being a black person and a black woman in America, and she uses this to create her own anonymous blog to write about difficult topics that no one really openly discusses.
Another example that comes to mind is where Auntie Uju and her other doctor friends talk about leaving the residency programs to practice in white communities. She wants to practice dermatology, and most of our patients here are black, and she said skin diseases look different on black skin, and she knows she will not end up practicing in the black area, so she wants to go where patients will be white. This is just another example of how black communities are consistently deprived of quality healthcare because they are better opportunities seen in more predominantly white environments.
Healthcare is one of the biggest metrics of living that is contributing to racial inequalities in America right now. Project Noir did a case study on the experiences of black women in Cleveland after Cleveland was ranked dead last among major American cities for livability metrics for black women. This study produced alarming responses regarding the quality of healthcare received by black women in Cleveland. The study by Bethany Studnick states, in addition with alarming regularity, local healthcare professionals refuse to complete necessary tests for black women or pressure anxious patients into invasive or medically unnecessary procedures and tests, all while accusing black female patients in their care of fabricating symptoms. Seeking healthcare and not knowing if you will ever be taken seriously by the medical professionals providing you care is entirely inadequate and could quite literally be killing black women.
I'm sure that leaves patients feeling hopeless. This is something that could be prevented and save so many people's lives if the right changes are made.
Absolutely. The number of women who reported experiencing these issues in their healthcare experiences is beyond alarming. The case study reported that among black women in Cleveland, 41% of respondents have been told that their health issues are not real or made up. 34% have also been refused medication for pain or pain management. The intersection of female racism and sexism in the healthcare system is directly affecting the quality of healthcare provided for Black women in America. And this is an issue that cannot continue to be swept under the rug if America is ever going to make progress towards providing equality.
Sorry for the technical difficulties, folks. Let's get back into the material. Michaela?
Not to talk about Americana too much, but this also shows how the role of a provider also makes a huge difference on the care of Black communities. In Americana, the author states, she, talking about Auntie Uju, walked into an examining room, and a patient asked, "Is the doctor coming?" And when she said she was the doctor, the patient's face changed to fire clay. Where's the real doctor at? Are you kidding me? I don't know about you, but the aggressive part of me would have taken over if I ever been through this before. I was reading about the microaggressions against anyone who is not white in an article the other day. It was talking about how racism and ethnic discrimination threaten the diversity of the healthcare workforce and have been associated with decreased opportunities for career advancement and increased job turnover. As stated by the Journal of General Internal Medicine, racism and ethnic discrimination within the healthcare workforce occurs at multiple levels, including structural racism within medical institutions and individual level discrimination from colleagues and patients. Among healthcare workers of color, 85.2% reported experiencing racial and or ethnic discrimination. All healthcare workers of color were significantly more likely to report discrimination from patients compared with non-Hispanic white males and females.
Okay. With us, we have a fellow UC nursing student, Renique Roden. She is here to talk about her personal experiences with discrimination in the healthcare setting.
So with us here, we have Renique Roden. She is an Ursuline student and nursing major.
Hi, how are you guys doing today?
We're really good. We just have a few questions for you. Have you ever felt discriminated as a patient in the United States?
Words cannot describe it. Like when you go to the doctor, that's supposed to be the place in which you feel safe. But due to the ignorance, sometimes you feel such discrimination. Nurses thinking that you're so uneducated due to the color of your skin. People thinking you're combative because you're asking questions about your health. People think you don't even live in a good community due to the color of your skin. But you know what? You always do. You always have to prove them wrong.
Thank you. Have you felt like your concerns about your own health care, like they didn't believe you, that you were over-exaggerating everything that you felt?
Oh, let me get into this. Yes, I definitely have. They always play you as the angry Black woman when you're just trying to vocalize health concern. Did you know this factor affected so many African American women? African American women have the highest maternal death rate out of any ethnicity in the entire United States. You know why? Oh, you're feeling pain. Oh, you can handle it, because Black people, they say, handle pain much higher. Or when you go to the doctor and they think you're ignorant, you ask for extra tests, they think you're being extra. But you know what those tests always end up being? That I was right. Because who knows your body like you know your body? Do you get what I'm feeling?
No one knows you like yourself.
No one knows me like himself. And that's why we have to advocate for having doctors of our colors, because you might not understand because that's probably not the culture you grew up in. And that's why I always have to advocate for myself. And I'm in nursing school too. That's why I always have to advocate for my patient, especially my patients of color. Because we die way higher than any other race. And all these different health conditions that we have, hypertension, hyperlipidemia, strokes, heart attacks, they affect us way more due to lack of education and doctors thinking that we're being dramatic when we know our body. Because who knows us more than we know our own body?
Thank you. I have one more question for you, and it's a little about yourself too. So how do we change this? Oh, you're ready already.
Girl, you got me hot already, sis.
Going into healthcare, how can we make this better? Like how we need to fix this problem. It's obviously not okay. And as a healthcare future worker, how do you plan on changing the stigma as well?
First, we have to fix the ignorance. Ignorance is defined as something as not knowing. By educating our patients in a way in which they understand. Like, we have them discrimination classes, that does not work. We need better discrimination classes because these people do not know how to relate to patients of color or people that don't speak the language or people that have different cultural beliefs. I just think education is key to this. And let me rephrase that. Proper education is necessary to change this in healthcare, because there is too far. You see a lot of these conditions that we see in African American community. These can be prevented with education, primary prevention instead of tertiary prevention. We could definitely do this by proper education and having doctors and nurses and people of color, like having a very diverse work field. Diverse team, like who knows someone culture like them. Like, there's stuff in the Black community, sis, that you would not understand. That's all. Like, we have to educate patients. And let me give you this one example, like where education come into factor. So everyone know about the weave. My sisters know. So, like, you don't want to be scratching your head. You know that's going to mess up your hair. So we pat. And this one nurse, she thought the patient was mentally insane because she was not a part of the culture. So she did not know that. But thank God there was an African American nurse there to educate her. And that's how, instead of doing this, you do to scratch your hair. But see, education is key, because if it wasn't for the Black nurse educating that other nurse, that lady would have been committed for something that she didn't do.
Right.
So that's how I think education, and we need to have these real conversations. I just think we just need to educate people, and like we need to like educate them in a proper way so they don't feel like offended, even though some of them should be. But just educate them in a proper way.
And how do you plan on changing this?
By educating not only patients but also work. By also educating team members, and also getting more involved in management, and of course encouraging young Black girls and young Black men to get involved in the healthcare community.
Thank you so much for your time, Monique.
No problem. Anytime, Miss Michaela. See you guys next week.
Thanks, Renique and Michaela. The concept of all African Americans being put into such a negative category strictly because of their race is such a shameful concept of our country. Have either of you ever heard of binarism?
Nope, not ringing a bell.
No, I don't think so. Tell us about it.
Binarism is a way of thinking that is based on strict oppositions, whether it be white, black, rich, poor, evil, good. With this way of thinking, there are only ever two options and no gray areas. According to our wonderful Key Concepts text, the reduction of complex physical and cultural differences within and between colonized societies to the simple distinction between black, brown, yellow is in fact a strategy to establish a binarism of white, non-white, which asserts a relation of dominance. It's really a complex concept, but if you break it down to a simple black, white, smart, dumb, rich, poor way of thinking, it's easy to see how our country has categorized African Americans as one person.
That's so true. So by using binarism, America has fit both white people and Black people into two very stern boxes. By using this, all African Americans are thought to be less intelligent, less successful, less than white people, because they have always been put in a more inferior position.
So going back to our original point about our NFL players, these men are being discriminated against and refused help for their disabilities caused by their football careers simply because they are believed to be less intelligent, solely based on their race. It's just so hard to wrap my head around. I really hope that these men can bring change to the foundation and to other aspects of our healthcare in our nation as well.
Me too. Thanks, Michaela. Next up, an Ursuline student's cat is stuck in a tree behind Pilla. Will the rescue team get to her in time? Stay tuned. This is Kaylin,
Jocelyn,
and Michaela.
and this is Ursuline 10 News.